You know, it's a tough. It's not a tough question, but it's complex. So one of the objections or concerns about the vaccine was the speed with which they're rolled out, right? So a typical vaccine takes years, and the reason it takes years is not because of the basic science of how the thing is delivered. I mean, once that's worked out, let me put it that way. Once that basic science is worked out about how are we going to deliver the vaccine into the body and what's the mechanism by which we're going to produce an immune response, then a lot of the subsequent work goes into, is this stuff safe? And nearly every vaccine that's known has some amount of adverse effects. They're not common. They're often very uncommon and they're tracked, right? But you know, we know that a certain number of people out of a very, very large population are going to have some negative effects from having a vaccine given to them. Doctors don't like to emphasize those things because they're, you know, we're well aware of the anti-vax movement and things along those lines. So there's people that take those small instances and try to blow them up into this is why nobody should ever have a vaccine. But the perspective of a physician is that we see a very broad swath of the population. So we see people that come in with vaccine-preventable illnesses. We see people that die from vaccine-preventable illnesses, right? So we look at it from that perspective of, okay, what's worse? Is it worse to have some people get very sick or some people die? Or is it worse to have a generally much smaller percentage of the population have a potentially negative side effect from having a vaccine? That's the basic logic that underlies this, right? In other words, what would have been desirable if we had time was that, you know, we knew COVID was coming and we had lots of time to work out all the kinks in the vaccine and know exactly what we were walking into when we started vaccinating people and what kind of side effects to look for or what kind of, you know, adverse effects may happen as a result. But we didn't have any of that. So everybody walked into it, everybody being those outside of the research lab or those that were involved in the direct research projects, for the most part walked into it relatively blind because we didn't have any of that information, right? We just started giving the shots based on the research data that we had received from a variety of sources saying that it was effective. You know, what has happened since then, you know, there have been news stories about, well, you know, are some people developing blood clots, you know, as a result of this? There's, you know, research about, well, are some people getting some, you know, inflammation of the heart tissue as a result of these? We don't definitively know the answers to these questions, but some concerns have been raised, right? But you have to emphasize that these reports, when they're happening, are happening in a very small percentage of the millions and millions and millions of people that are getting vaccinated. What's the counter to that? And then this is kind of the thing to know, right? What's the counter to it? Well, the counter is that let's say we go to the opposite extreme. We're not going to vaccinate anybody. We're just going to, as some people are proposing, right? Let's just let the disease run its course. What does the course actually look like? Well, the people, let's set aside for a moment the people who say it's all a hoax, it's all, you know, it's all fake, right? So that's issue number one. So then take the people that say, well, you know, viruses happen all the time and it'd be better if we just let everybody just, you know, run through the population. And yeah, some people are going to get sick, maybe even some people will die, but whatever, we'll all be immune at the end of it. Well, the real problem that hasn't been stated is that 5,000 years ago, maybe that would have worked. Maybe 200 years ago it would have worked, because when people got really sick, they often just curled up in a ball and died at home, right? But that's not how our society works at this point. When you get really, really sick, we take you to a hospital, right? And we expend resources trying to keep you alive. Well, one of the frustrating things about this illness is that we tried all kinds of things, all kinds of medications, all kinds of different treatment therapies, ventilators, BiPAP machines, high flow oxygen support. We still, even now, don't have a consensus on what is the best treatment for this thing.